Come join me as we take a look at someone squatting at 22 weeks pregnant. In general, you can see that she's turning her squat into more of a hinge where she's folding over to get lower. There can be a couple things driving this. She can lack inlet interrotation and sacral nutation to open up her posterior hip musculature. If they go into more of an anterior pelvic tilt, they're often lengthening from their hamstrings more than their glutes. And if they go into a posterior pelvic tilt and rounding their back, they're lengthening from their paraspinals instead of their glutes. She can also lack foot pronation. This includes not only what's happening at the foot and ankle, but also the ability to have tibial interrotation with femoral exrotation and proximal anterior tibial translation with distal posterior tibial translation. She can also have poor ribcage positioning and core control to help her stay upright and support her pelvis. She is pregnant, so it's a bit of a losing battle, but it's still important to continue to work on maintaining what core strength and ribcage mobility she can as best as possible. Last reason is that they could just have a long femur to torso ratio. That might make them have to lean forward more to keep their weight over their base of support. It's important to look at how each side moves. We aren't robots, but general balance and movement and position is important. You can see how she has some asymmetries of each side at the top of her squat that creates a rotation in multiple planes and locations throughout her body. In general, her left side of her pelvis and rib cage are more forward over her feet to compare to her right side that is more shifted back. You can see how this affects how she lowers down into her squat. Her left side tends to tuck more of the pelvis, left knee shifts forward, chest drops down, and reaching her left scapula more forward to try to lower down. Applying some counter rotation and movements to each side in accessory work is needed to help untwist. This can help restore balance of position and movement to then translate into function. Training a split squat could be a better fit for her right now to help address the needs of the individual sides. From behind, we can also see asymmetries in not only her standing posture, but also as she lowers down. Think of it as the body hitting a roadblock that it detours around, which then affects how other areas are loaded. We need to address asymmetries at the top of the position. This then helps improve the position for which she can start to lower down into her squat. Then we're making sure that her entire lower body can go through its full range to help continue her to sit straight down. The asymmetry can be coming from the hips, the lower leg, or even the rib cage and shoulder. That's why it's important to address the individual parts. She reports that squatting on a ramp helps. That can help with limited ankle dorsiflexion range, but it can also help with how you have your weight over your feet to allow you to sit down into your hips more. You can load her squat like that, but I'd still want to look at the individual components that could improve muscle function and movement. As you address movement, it's important to also take into consideration what your client feels in a movement, complaints they have, and their goals. Check the caption for more thoughts and details.